Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today I've got one of my favorite lower back healing exercises that I share with my patients and clients alike, known as the seated hip shift maneuver. Hope you enjoy. So I like the seated hip shift maneuver because it addresses many of the mechanical problems that we all have when we're suffering from lower back pain. Whether you have degenerative or herniated discs, stenosis, spondylolisthesis, chronic sprain, strain, facet syndrome injury, many times the mechanical stress is feeding your problem that you're going through every day on a micro stress level is the same despite the diagnosis. And what I mean by that is many people with lower back pain suffer from an externally rotated leg where one thigh has a tendency to turn out more than another when they're sitting, standing, sleeping, laying down. And on that side, the hip then has a mechanical tendency to elevate or hip hike up, causing an associated side leaning tendency. And you'll know that many times if you stand on one leg. As you stand, you'll have more of a balance problem on that side where the hip will come up and the rib will lean in, or if you close your eyes, your first motion will be leaning into that side. If you look down at your feet and stand and walk, you'll notice one leg goes out to the side more than another. So the hip shift maneuver can be done in a bunch of different positions. A lot of my patients and clients say, Doc, I really don't have time to do this hip shift maneuver laying down in the middle of my day. But we all sit during the day, and that's a great position to take advantage of the healing stimulus effects of the hip shift maneuver. So what we do is as we're sitting, I'm going to show this to you in a couple of different directions or angles so you can get the gist of it. We want to make sure that this thigh is internally rotated. Okay, because it has a tendency to go outwards. So what we want to do with this thigh is we want to make sure that our foot moves out to the side compared to our knee. You see what that does? That allows my knee to roll inwards. If my foot was in to the midline, my leg would move out. That's an external rotation. That's the problem. So I'm doing the opposite. I'm taking my foot, moving it out to the side a couple inches. That allows that leg to turn inwards. Then what I'm going to do on that side is I'm going to pull my knee straight back through my hip, and that's going to correct something called an anterior hip malposition or anterior glide tendency of the left hip, which is common for a lot of people with externally rotated legs, and that wakes up the muscle that pulls that leg backwards, okay, into the socket. That wakes up the glute max, which is your main buttock muscle, which many people with lower back pain, that's an issue. That muscle is weak. So my foot is out to the side, my leg is back, and all I'm doing is I'm pushing my hip, my top of my pelvis, downwards. I do that by elevating my right hip up a little bit. So I'm just swinging my whole pelvis this way. Left hip down, right hip up a little bit. And at the same time, I'm turning my pelvis pubic bone into that side. And why do I want to do that? Because in a typical external rotation, my pubic bone or pelvis turns away from the leg. They're opening up away from each other. So with this maneuver, I'm actually closing them. So the 4 points you're remembering is the foot to the side, allowing the leg to fall in. I have a backwards tension or movement of my knee moving through my thigh bone, causing my hip to move backwards. Okay, that wakes up the glute muscle. I'm going to keep my hip down on that side by raising the other side, swinging my hips, and I'm going to turn my pubic bone into that side. Make sure you're not leaning to that edge also. A lot of people when they're sitting with this type of scenario or mechanical tendency have a tendency to lean more to that side. That shoulder will be down, the other shoulder up, so keep your ribs up. And I'm simply going to hold that for about 90 seconds. I can try to increase the buttock tension by using a little tailbone under tension or pubic bone up tension, engaging my abs. That'll help me to squeeze the buttock, release the tight back muscles. And what this is doing is it's creating a facilitated wake-up call to all these weak muscles in my postural system here, my mechanical disturbance, and an inhibitory or a quieting down signal from my neurological system to my muscles that are overactive, including back spasm, areas that get a lot of trigger points like the quadratus lumborum, the erector spinae in the back, and after 90 seconds I'm simply going to release that. Let me show that to you from the side. We're going to, let's say if it's my right leg, I'm going to bring that out to the side, internally rotate, backwards slide my knee towards my hip, squeeze that buttock, stay tall, and rotate my pubic bone in a little bit to my thigh. Again, holding 90 seconds. This hip is going down, the opposite hip is going up now. From the back section, this is what it'll look like. I'll show it to you again on my right side. I'm going to put my foot out to the side, lean in. I have a back slide with my leg, waking up the buttock. Going to keep this hip down, the other hip up, keep my rib up, and turn my pubic bone into that side, holding for 90 seconds. So, if you like this video, the concepts that we're sharing, a lot of you have written in, a lot of you have gone to the website, enjoyed our healing programs, purchased them, doing better with them. Plug this one into your daily activities. Regardless of your exact diagnosis, many times these mechanical disturbances are in low back patients as well as hip patients across the board. If you like this kind of video, would like to learn more, subscribe to our channel. We got a lot of great videos on low back pain healing exercises. If you'd like to help me share this vital information with others, give me a thumbs up below. Any questions or comments, please leave them. I'll do my best to get back to you on this topic, or if you have a suggestion for another topic, be delighted to cover it. I hope this seated hip shift maneuver helps with your lower back pain.